Good afternoon. Thanks. Welcome. Thanks for joining us. We will be discussing cross-functional adoption and how to achieve full system adoption in 2 weeks. I know I have a few people joining us today. Thank you for joining us. I just want to welcome you. I appreciate you joining us as we will be discussing what are some of the experiences that I've had and my company has had over the past 17 years, supporting healthcare implementations. And what we're going to talk about is really look at what's happening in the healthcare industry as it relates to adoption failure and some of the experiences that have enabled us to ensure that we get full adoption. And so part of our discussion is going to be looking at what are some of the challenges and what are some of the things that have happened or that we can kind of share with you that have made it possible for our projects to finish on time, within budget, and have a positive outcome on the impact that they're having in the environment. So when we look at healthcare and we look at some of the digital transformation, some of the changes that are happening in healthcare, what we're finding out and research is showing is that there is the initial positive push to get the system implemented, but it does have its errors, it does have leadership challenges, and it does have the sustainability that is increasing the cost of healthcare. So when we look at what's happening, we're looking at how do we support healthcare organizations move from failure to transformation? How do we look at the threats associated with risk and other IT issues that are prevalent in our market to opportunities? How do we also look at ways that we can fight burnout and continue to increase engagement for those individuals that are using the system? And then how do we fight resistance and turn that into adoption? And so, looking at our model, we're going to talk about specifically looking at change management. We're going to look at IT leadership, and we're going to look at training and how that relates to the quality and relates to the outcomes that are part of the project. And when you're planning any type of IT implementation. We are in a different world where there are IT challenges, multiple layers of technology that's being implemented at once. So, how do we take away the complexity and really focus on what we can do, not just with the tech, but what we can do for those that are working in healthcare and supporting patient safety and providing the resources we need to ensure optimum health? So when I look at the data, research, I said, let me see how big are the adoptions pitfalls. Because again, working with the organizations that I've worked with in collaboration with them, as well as taking leadership role, we've been able to get full adoption and full adoption from a standpoint of making sure that it's on time, making sure that it's within the budget, and making sure that we have people trained who on day one have an understanding of what their job is, but by the end of 2 weeks, how technology supports them in doing their job. Globally, from the research, what we found is that digital transformation fails to meet the objective and faces challenges beyond technology. We're looking at higher degrees of issues surrounding digital transformation. So what we see is that 70% of digital transformations fail to meet their objectives that are continuing to grow. Right currently, research shows that 12% of annual revenue is wasted or has a negative opportunity cost due to failed transformations. 62% of organizations completely failed to document and communicate transformation, not having any record or not communicating the processes that were being put in place. And then integration failure, 60% due to poor quality have increased the average cost or direct cost to 2.5 millions on average. So that's getting data that you cannot use, getting systems that are not functioning as they were designed to function. So, what we have are a few recommendations, and those recommendations are to achieve cross functional adoption. What we would like to do is to master organizational change. We'd like to lead IT with confidence. We'd like to design learning that lasts, and we'd like to make sure future proof your workforce to ensure that they're ready for what's coming next as trends grow, as AI continues to grow, as well as the threats in our system continue to hamper the work that we do. So, how do you master organizational change? After the pandemic, after COVID, what we saw was that organizations had to be flexible. They had to adjust and they had to make the changes in order to survive. Healthcare, it was probably even more prominent than any other organization in that the resources and the time and the people who invested in doing all that they could to help individuals was a method of adaptability and flexibility that went beyond what is traditional. And so the urgency of responding to the need still permeates in our culture today. And with the onset of AI, what we're looking at are systems and processes that are outdated. So the need to modernize, update processes and your system became very evident during COVID. There is now this other element of AI that has made the industry even more complex. So, when we're looking at mastering organizational change, what we're looking at is incorporating best practices not only around project management, but also around program and portfolio management. So, we're looking across the organization to say, why are we doing this? What is the business case for that? How can we justify what we're going to do? And how is that going to impact our employees, our workforce, our customers, our stakeholders overall? So, in doing that, we want to make sure that we provide a clear vision and the business case for the change. We want to make sure that we're building trust, we're involving our employees, and we're communicating in an open and honest way so that there is buy in, there is knowledge, there is understanding, and that communication in creating those plans and creating those channels should integrate in our entire project and our business processes for implementing any kind of digital transformation. How do we incorporate risk communication? How do we incorporate cybersecurity? How do we incorporate cost and resource management? So, all of these things support change and making sure that we incorporate those plans and those strategies into our overall change strategies. Now, what I can tell you is in mastering organizational change, we did months of planning. We knew we had a large initiative, and so spent the time to create plans and strategies and put those things in place. Now, with COVID, many of those plans went up in smoke, but there were several that were there that helped support our change. So being able to say, okay, if we're not going to bring people in for classroom training, what can we do and how do we look at the risk and the access and security and the resources and the cost to have them doing it virtually or online? And so, having those plans, we were just able to pull out our risk management plan and add to it and look at what some of the other risks were and be able to then reprioritize those and continue moving forward. So having plans in place, having a way to pull those plans out and put them into action is things that you do in the pre-planning to make sure that if there is a change, being able to identify where your resources are, what additional funds I may have, what security I may have to update, saves time, which also saves money and gives you an opportunity to look at the value or look at the cost of what that change may be. So what we learned is that at each phase of it, it was important to communicate. It was important to be open and honest. When we brought people in for training, we had to set up rooms because at the time, even though there was not a desire to have classroom training, we had to bring people in because people didn't necessarily have computers at home. And if they did, if they had children, their children were possibly using those computers for school. So, knowing that they may not have had the resources, we wanted to make sure they had access to a computer to be able to take the training that was required. And we made that training flexible. So we had our rooms available and accessible for individuals to take that training from 7 a.m. to 11 p.m. And we staffed that with proctors and support, and that helped with the adoption. And we communicated with our team that this is a moment of silence and peace, even though they're taking training. They have just left the environment in which they have been working with COVID patients and all of the trauma that was associated with this. So, trying to make sure that this environment was a safe place to learn, a trusting place, helped build those relationships. And when the system went live, people were able to connect with individuals that they supported in those classrooms and really found it as a positive and smooth change because there was someone who was recognizable, someone who'd answered their question when the system went up. And so being able to not only transition, but being able to build those relationships while you're building trust and establishing adoption over resistance was important to mastering that organizational change. So, how do you lead with confidence? So when we look at leadership under IT and change management, leaders who are confident, research shows, achieve over 2 times higher success rate. Understanding what your role is, what your responsibilities are, and understanding how do I achieve those goals with the resources and the team, and how do I then communicate that out so that people understand what their role is and the responsibility and how this impacts the organization. So organizations with strong integration activities are also 10 times stronger versus poor integration. When we look at leading IT with confidence, we're not only looking at a particular system that we're implementing, you're looking at all of the third party or legacy systems that also have to be addressed and looked at. If you were able to understand how those applications integrate with your current systems, you're more likely to achieve success. So, understanding where this application touches another application, understanding your infrastructure and your network and the workflows also help to ensure that when you lead or when you're developing, you're confident that what you're going to do is not going to impact the organization, but it's actually going to enhance it. How do you do that? You deconstruct, really try to bring them down to understanding level of a non-IT and understanding how, from a team member's perspective, how this particular application is going to support what I do, as well as give me the information, the knowledge, the tools to better provide patient safety. And so, in doing that, being able to work with training, work with change management, work with leadership, and provide support for adoption and have measurable outcomes so that you can have checkpoints and gates to say, are we moving in the right direction? Have we got feedback channels? Have we got test groups? Do we have people who can provide reassurance that the steps we're taking are in the right direction? That once we get to the end, we're going to have what we have agreed upon as far as the system. And then how do you motivate and unify your team and help to improve that? And that's again being confident in what your solution is, being confident, flexible, and adaptable to where our discoveries are, where our incidents may happen, what risks may appear, and access. All of these things have been addressed in our planning, in our pre-planning, in our processes, that if there is change when we're monitoring the project, are there controls that can bring it back into alignment when they deviate? Is there governance that can provide decision making and approval on things that are necessary and maybe were not part of the original plan? Leading with confidence, you want to make sure also that as you move through the life cycle of the project, that you are communicating the value and the benefits along the way. Those discoveries help to support adoption. They help to support funding. They help to support governance in that. And so I can give you an example here in that same COVID project was a multi-year, multi-state, multi-phased Big Bang implementation, which was not only were the hospitals going up, but we had ambulatory clinics as well as home health and hospice that were all going up by region. So in one region, all of the hospitals, all of the ambulatory clinics, all of the home health all went up at once. So when we approached that, it was massive. But being able to break that down, being able to look at our strategy, being able to run that by and make sure that we had things like access, that we had things like VPN or protocols for people who were working remotely at the time. And how we achieved that was that we did a pilot program. And that pilot program produced results as well as feedback and lesson learned that we could then incorporate into the larger project moving forward. So that's how testing, piloting, focus groups helped our leaders lead with confidence because we had proven records, we had examples, we had data, and data is critical when you are making decisions. The next thing that's important to cross-functional adoption is making sure that you're designing learning that lasts. And designing learning means that you're investing in it. You see the priority, you see the importance of it. One of the things it says that organizations that invest in data literacy and training have a 35% higher productivity and 25% better decision making. And you do that in your investments, in your resource management plan, in your planning, in your cost, in your budget, incorporating training that's not only specific for the actual system, but knowing how that fits throughout. What is that transferability in which we can say, here's what we did, here's what we expected, and here's how it impacted our workforce? Learning opportunities, when you're designing those, make sure that they're rooted in adult learning principles, culturally aligned with your organization, and aligned with the business objectives. When I say adult learning principles, what we're looking at is self-directed. We're looking at opportunities for individuals to choose the type of learning they have. So we have not only formal learning, we had informal learning to meet the preferences of the learner and support their performance success. We allowed users to take an active role in supporting training, helping us with some strategies as far as how do I get nurses off the floor for 40 hours, knowing that there's shortages, knowing that there are HIPAA and other regulatory requirements as far as patient to nurse to patient ratio, and then other bargaining organizations. How do we take all of those factors together? And we only knew those things because we were communicating with the end users on supporting those kinds of strategies, made aware that those were requirements, and designing and delivering it, and additionally providing them with post implementation support. And we also want to make sure we plan and promote the transition. So, as a consultant or as a project team, it is a temporary endeavor. People come together to work to the project, but it has a beginning and an end. So, at the end of that, we want to make sure that we have prepared, whether that's HR, whether that's a legal team, whether that's finance, we've prepared them to accept training moving forward. And so we do that by creating a plan and promoting that plan as early as possible so that one, when that day happens, they're ready to take over. So I wanted to talk about designing learning that lasts. Before consulting, I worked for the Federal Reserve. And one of the things that they did, because they were a large organization with a diverse workforce, and because we were creating training utilized across the system, we had to create it in multiple formats. And so when I say creating formal and informal training, that means having formal classroom training, whether that's online or virtual, having self study, having e learning, having quick reference documentation, having multiple avenues for learners to access training. In addition to that, making sure that there are practices or places or scenarios or simulations that allow them to get some type of hands on experience prior to going live with that system. And I've seen that transition in that this is the way that we do it. We're going to have classroom training. People are going to come in. COVID changed that. And not only did COVID change that, it also created an avenue for multiple methods of delivery on one single topic and on one implementation so that people had the opportunity to choose the way they want to learn. And that aligns with adult learning principles, which again helps to enhance that adoption, helps to enhance the transferability to their back to their workforce. The other point that I want to talk about here is allowing team members to help support the training strategy with helping us design scenarios that would work or people would better understand. So real world examples, but also participating in training. During COVID, there were departments in the hospital, and specifically, I'm referring to occupational therapy or physical therapy, in which individuals were not bedside care. And so they volunteered to help us continue to roll out the project during COVID. And you ask, why would you roll out a project during COVID? Because there were business requirements and restrictions that made it unable to stop the progress because we were moving off one system and having to have the data and the information merged and put together into one system. With COVID, we thought, okay, we're going to stop. But because of the business requirement and objectives at a much higher level than we knew, we had to move forward. But that was communicated down to us. So we had an understanding. We had an understanding also that as consultants, it was very difficult to find people to come on site, not to deliver the training, but to support individuals taking classes. Our trainers were all virtual, but we had proctors that needed to support the classrooms. And so getting not only people who were willing to travel, people who were willing to be in the classroom with other individuals during COVID, but also having team members who were part of the organization, not consultants, but volunteered to take on this role and support training. And not only did they help with the proctoring, they also decided they would help with some of the training. They went through, got their certifications, and were able to deliver training to support not only their department, but also add value to other departments that were part of the five additional hospitals that had the same occupational safety and PT departments. They added extreme value to our project by not only championing the change, educating folks on the change, as well as supporting our team and those learners pre and post go live. Another aspect of making sure that we have cross-functional adoption is developing strategies to support retention, to support certification. So people are getting their renewals, they're getting their certifications to improve the knowledge of the organization, and then equipping them with this cutting edge AI, giving them technical expertise, and as part of their involvement in this, really giving them leadership skills to support the vision and the mission of the organization. What we find is that upskilling efforts, we're looking at a 20% increase in productivity and a 15% reduction in medical errors in the healthcare setting. You're also looking at if you have continuous learning, 72% of healthcare workers agree that continuous learning improves their patients' outcome and overall quality of care. This is them stating and affirming that professional development benefits not only the organization, but also patient outcomes. And then the role of training programs in the organization itself or external programs like our Certs Up program. We're working to equip individuals with the skills and the knowledge they have to become more efficient, help organizations more knowledgeable and adaptable to changes, as well as enhancing the retention by giving learners additional benefits to continued employment. Future proofing your workforce really talks about continuing professional development, as well as utilizing resources for exploratory new trends that can help support the organization like AI, but also providing additional skills to support things like cybersecurity, risk management, things that can help reduce unexpected costs or unexpected incidents due to threats or other culprits in the market. So, our approach, Amela Consulting, what we provide is a commitment, an approach that works to support organizational change. And we do that through looking at change management, leadership management, and workforce development. Now, this constraint looks familiar because when we look at project management, we already have these structures in place, such as the triple constraint that deals with the scope, the schedule, and the cost. If these are adjusted or changed, it affects the other. In the middle of that is also quality. So making sure that quality is incorporated in that, in the quality that is measured through dollars and outcomes and deliverables, but through tangible and intangible, through satisfaction, customer feedback. And that's the appreciation or the adoption, the work that goes into creating that quality. And then you also have your engagement triple constraint, which deals with aligning your communication and your strategy, getting resources that are dedicated, and recognizing those resources. So really deals with how do we touch, support, align with those individuals that are stakeholders in our project, as well as those that are contributing and collaborating and supporting the change. Amela Consulting takes all of these and really constructs solutions that support your organization. We look at where you are, where you're going. We look at external factors that affect your organization, and we look at resources and how we can support those resources, those decisions to make sure you're meeting your outcomes. We do that by really having a system in place. And that system is called our real system. And that real system incorporates research, education, and leadership. And we do research to help you analyze and understand what is the core problem, what are the things that you're trying to achieve, what historical data can you provide, what's in the market if we need to do research to help you make decisions. So that is part of our research component. Education, we're really looking at how do we support your organizational development needs through training, through adult learning, through change management, through project management, implementing changes that affect your organization. And then we also bring leadership, technical, and business expertise. All of these things combine to create our real solution. Our goal is to optimize the investments that you're making. And so we're investing in your people as well as the technology. Our comprehensive consulting expertise, we have a wide variety of skills that support complexity from small implementations and even international teams that support change management. Looking at how do we customize what is needed for you, or if that is just knowledge that is important to support your next initiative, we can provide that service. The goal of our team is to partner with you. Our goal is to collaborate and customize the solution that helps you meet the goals and objectives within your organization, not only for yourself, but for the customers you serve. We are here to collaborate, support, because we believe that coming together, bringing people together can create greater output than siloed, and collaborating to create something new is what we try to do with our real system. So let us know if you're preparing for digital transformation or you're in the middle of it. We can, again, help you with research, education, and leadership that helps drive organizational transformation. We can create programs of certification or training or workforce development through our Certs Up program. And then we collaborate with you to break down or deconstruct your needs and maximize the impact. So we're giving you the strategies to partner with you to meet the needs of your clients. And that's how we bring our expertise to organizations to ensure that they meet adoption in 2 weeks. In cross-functional adoption, what we've done is we have worked with organizations to bring everyone forward within that organization and not leaving people behind, but really looking at how we can, just as you invest in technology, we invest in supporting you so that you can help individuals achieve the goals and the desires and the outcomes that are part of your organizational vision and mission. Let us stand in the gap, bring the organization forward. Thank you. I am happy to take any questions you may have. We can also, if there's a specific question, please feel free to connect with me on my calendar. You can connect and schedule an appointment. My availability is listed there. Thank you for joining us. We appreciate your participation as well. And if you haven't connected, connect with me, or you can book some time on my calendar and we can discuss any additional questions you have. Have a great day.